Hello, I'm here during the lunch rush with Janice, who owns her own food truck.
Best cheesesteaks in town.
Janice traded up to Geico Commercial Auto Insurance for her food truck business. We're here where she needs us most.
They sure are.
We make it so easy for her to save, with customised coverage that grows with her business. Sorry, I just get so emotional talking about saving folks money.
Not this onion I'm chopping?
It's just so beautiful. Oh yeah, no, it's the onion.
Get a commercial auto insurance quote today at geico.com and see how much you could save. It feels good to Geico.
Yay Media Group.
A quick note before we dive into today's podcast. If you like what you hear, I would love for you to subscribe to Fueled Wellness and Nutrition, wherever you download your podcast. It would also be incredible if you take a minute to rate and review this podcast. Those things do matter and they really help us. I'm Molly Kimball. Welcome to Fueled, a wellness and nutrition podcast. I'm a registered dietitian and nutrition journalist with a passion to help people live their strongest, healthiest life possible. In my weekly TV segments and columns, there's a limited amount of time and space to cover everything, but there's so much more to share. This podcast is my opportunity to dive deeper into the topics you want to know about. So a lot of women start noticing changes in their 40s, especially in their 40s, and it's brain fog, sleep disruptions, changes in our body composition, how our clothes are fitting, changes in our skin, and it can feel like things just aren't right, and we're also not sure what's driving this. These changes, though, are often connected to the hormonal shifts that come with perimenopause and menopause, but it's not always so clear. It's not always so easy to identify. A lot of people think about hot flashes or night sweats when we think about something like menopause, but the reality is that the hormonal changes, they affect literally head to toe, from our brain, our muscles, our metabolism, our skin, so much more. And for so many women, these symptoms are beginning years before menopause actually hits. So today, we're talking about what's actually happening during this time, these head-to-toe effects of menopause, and why so many women experience these symptoms that we're not even realizing are connected to these hormonal changes. Joining us today is Dr. Liz Lapeyre, board-certified gynecologist with Ochsner Health and medical director of the Menopause and Women's Wellness Center at Ochsner Baptist. She also serves as the system medical director for integrative oncology at the Gail and Tom Benson Cancer Center. And Dr. Lapeyre speaks locally, nationally, and internationally on women's health, menopause, and cancer survivorship. Dr. Lapeyre, thank you so much for carving out the time and joining us today.
Thanks for having me. Excited to be here.
There's so much in this conversation. Is this one of the top questions and topics that you get asked about, menopause and hormones?
Yeah, all the time, everywhere. At the grocery store, at cocktail parties, yes. Men, women, everybody.
Right,
so, yeah.
right.
It's a hot topic, which is good. It's good that we're talking about it.
And it's something that I think people are more comfortable talking about than they used to be.
Agree.
Tell us a little bit of your background, kind of what brought you here, your expertise. But for our listeners, we're going to be diving into a lot, but I want y'all to get to know Dr. Lapeyre first.
So I've been in practice for over 23 years, and a large part of the first part of my career was obstetrics. I delivered a lot of babies, delivered most of my own babies. And then as I started aging and my patients started aging, because I've been in the same practice for years, which is great. I've grown with my patients. I started realizing that I really didn't know how to take care of them anymore. They were coming in with complaints. Labs were normal. They just weren't feeling like themselves. And I'm like, I really got to figure out how to take care of these people, because I didn't learn about it in residency. I was very fortunate to have an older man in my practice when I first started, Dr. Charlie Ferris, who was very passionate about women's health. So he taught me, but I was so busy delivering babies, it wasn't my focus.
That's Meg Ferris's dad.
Yes,
exactly. I heard her talk about her dad a lot.
Yes, he was
Meg
great.
Ferris is one of our local news reporters.
Absolutely.
And he was sort of on the cutting edge.
Way ahead of his time.
Yeah.
Way ahead of his time.
Right.
So I was very fortunate to train under him. But, I didn't appreciate it until later when I really started taking care of these patients. But I still had all my notes from what he taught me. Right. So fast forward, I decided to get menopause certified because I just feel like that shows that you have got clout, you've taken the extra time. And then I did some integrative medicine training. I got a fellowship in integrative medicine because I just wanted to be able to take care of my patients, completely and offer them different things. And so now my practice is completely GYN. I still do some GYN surgery and some women care, but my focus is really perimenopause, menopause, and then my cancer survivors.
One of the things we'll be talking about, but I kind of want to jump straight to this. What are some of the symptoms that are the
the least connected in people's minds to menopause. That when someone comes in and they may be coming in for an entirely other reason to talk with you, and then this sort of comes up and you're like, hey, that's actually something for us to put some attention to, like, but they're not realizing that it's related. What are some of those surprises?
Right. So you hit on it earlier, the hot flashes, night sweats, I think everybody kind of gets, but the brain fog, the change in the sleep. And the big thing is not just falling asleep, but it's waking up. It's wake after sleep onset, WASO. That happens a lot in midlife women. And then fatigue, joint pain, that's a big one. Joint pain is a huge one. Some anxiety, women who've never been prone to those feelings of anxiety or just not feeling like themselves, maybe some depression. This is a time, this is kind of a window when those things start occurring more so, and they don't really realize it.
And without realizing it, they're just wondering what's happening to me.
Right.
Like, what's going on? Like, all of a sudden, everything that kind of felt like was their usual routine or who they are, that whole definition might start to feel different.
Yeah.
And it can be really validating, I'm sure, when they realize, oh.
Yeah. Well, my own experience was my middle boy, who was, I don't know, in his 20s at the time. And he was like, Mom, you need to see one of your friends about Xanax or whatever you need to do because you're making everybody crazy. I was like, maybe I'm perimenopausal.
The honesty.
Yeah. I was like, thank you. Thank you for that.
Wow.
Yeah. So anyway, it was just eye-opening. The finance kid is like telling me about perimenopause.
Yeah. Telling you.
Yes. Telling me.
Right.
Like, I fix it.
But he was like picking up that like something's just not right. Yeah. Did you feel it, or you felt like you were kind of short or like maybe edgier than usual?
Edgier, definitely edgier, not sleeping well, stressing about, I'm not usually I'm high stress about some things, but I was just stressing about stuff that I shouldn't
Doesn't matter.
Stressed about. And waking up in the middle of the night, with night sweats. Hello.
Right. Right.
Yeah. But the brain fog, the concentration, all of that, I experienced it. For sure.
That's yeah. I love the honesty of someone who's close to us too. So listen to them.
Yeah.
If they're
sometimes.
Right. So Dr. Lapeyre, there's so much that are really surprising symptoms of menopause and perimenopause. And it can start to feel a little overwhelming. And we'll be sharing with y'all all these things, and some of them are going to be bizarre things that are symptoms. But before that, let's share like what the bright side is, that these things can be treatable, and what you see like in your clinic when you're working with women and they do start to find that balance, that hormonal balance, and the doom and gloom we'll be talking about. Let's hear the bright spot first of where people can land.
Yeah. Well, I think it can be a great time in your life. I think it's a time when you kind of have come into your own and you're not really worried about what people think of you anymore. You're the wise woman in the room and you can just kind of relax and be. But we have to help you get to that point. And so I think a lot of women just feel like once this happens, they have a cloud lifted. They feel more focused, they feel more energized, and it's just a big change in their life. And it can be just an amazing time.
And so people are coming in and they're feeling like something's off, things aren't right, what's wrong with me, things are, and some of it is going to have to be other things that aren't going to be related, of course, hormonally. But some of those, I would imagine, are people even doubtful that I don't want to say just or simply, because balancing our hormonal levels is going to be a huge thing, and optimizing, I would say, for the individual. But are people even like, is that going to make that much of a difference? And then they're stunned that it does?
Yeah, they are stunned. And the thing I hear on a regular basis is game changer. Yeah. Game changer. And I think there is some doubt because some women come in and they have felt bad for so long and they just haven't been able to get to the right provider to help them. And so they are a little shocked that it's going to work. But they trust in us, and I think we developed that relationship. And I hear from husbands, I hear from partners, like, this has changed our lives. So it's just really, rewarding to be able to work with these women. And they do have to do the work. Like there is, and sometimes I feel like I'm kind of barking out orders about all the things you have to change. And it doesn't all happen at once. But these are like lifestyle shifts also that you make. And I think when you partner with the right provider, we can kind of guide you through this time and work together.
I would imagine the confidence that people have that maybe they had it, they've lost it, and as you see that start to come back.
Yeah, they feel like themselves again. I hear that a lot. Like, old me would have done this. Old me would have gone to that game last night. The new me doesn't want to do that, and I want to have the energy to do the things that I used to do. So I hear that a lot. So
that's got to be incredibly rewarding.
Yeah, it's awesome. Yeah.
So tell us, what's the difference the difference, just starting with the basics between menopause, perimenopause, just walk us through that. And then we'll start getting into kind of these symptoms and what can be done for each.
Sure. So perimenopause is kind of a longitudinal time, and there's no like start or stopping necessarily. And it's a time of wild hormone fluctuation. So there's a lot of up and down. Women feel very unsettled. A lot of them come in and want to get labs, and I totally understand that, but they could look one way one day and a different way another. And it can start in our late 30s, early 40s, and it can last for years. And the symptoms can be really severe. And what's changed is that when I was training, we didn't start even discussing the thought of hormones until you had been a year with no period. So good luck to you.
How would someone start to identify, okay, here's where I am?
Yeah. So some women just start having maybe some mild night sweats or hot flashes around the time of their cycle. So some of the symptoms are more cyclic. A lot of women just come in saying, I'm not feeling like myself. My afternoon energy is bad. I'm waking up in the middle of the night. I'm more anxious. Just kind of some vague symptoms like you talked about. Joint pain can kind of start, because they're trying to exercise. And then also they start noticing what used to work for them to lose weight, cutting their carbs, exercising a little bit more. That's not working anymore.
Right.
And they start gaining.
And they show you, I bet. I mean, they come in, people, they grab it and
they
show us.
They do. Or like, I used to be able to wear this dress.
Right.
This is the goal, things like that. So, yeah.
But it doesn't have the same strong boundaries or the same strong definition that menopause has.
Yeah.
It can be a little bit more of those blurry lines.
Right.
So when we say the symptoms of menopause are truly head to toe.
Shop the Sherwin-Williams 4th of July sale and get 30% off paints and stains June 26th through July 6th. Whether you're refreshing your interior or exterior, we've got the colors to bring your vision to life. And with delivery, getting everything to your door is easier than ever. Shop online to have it delivered or visit your neighborhood Sherwin-Williams store. Click the banner to learn more. Retail sales only. Some exclusions apply. See store for details. Delivery available on qualifying orders.
Help us. It's hard to wrap our head around, I think, that changes in estrogen, these drops in estrogen, can affect all these aspects of our body, that our vessels are affected, our blood vessels are affected by estrogen levels. So how does that happen, and how are all these things interconnected?
Yeah. So we do have estrogen receptors all over our body, from head to toe, you're right. Brain, skin, heart, muscle. And so it does affect things, because when that estrogen starts going down, that's when you start noticing changes. We start losing lean muscle. We start gaining central fat. The way the brain is actually fueled changes. Your brain is largely fueled on glucose, and that changes when we go through menopause. There are 3 times in your life when your brain changes. It's puberty, pregnancy, perimenopause, and menopause. It's not permanent, but that's why women start having these cognitive changes, because the brain fuel is different. So you walk in the room and you're like, what did I come in here for? You can't remember anything you wanted to put on your list, much less follow the list. So those are all real. Yeah. And that doesn't mean dementia's headed your way. It's just those are real changes.
Right. And things like LDL, our quote bad cholesterol, hemoglobin A1C, these things can all start to go up.
Correct.
And be impacted by it. So we're not remembering anything. Our cholesterol is going up. Maybe it hasn't before. We feel like we're on our way to prediabetes. So it truly, for people, it can feel like they're falling apart. And it's all of these. So when someone does start to put these pieces together, and they're kind of paying attention to these signs, they're working with their provider, they're meeting with their gynecologist like you and talking with these things and sharing. If someone is, let's say, using just myself, for example, at 51, my LDL was on the rise slowly but surely, and nothing else nutritionally had changed. Nutritionally, I had things, set up well. Physically, having that regular movement, but it was steadily raising from the 100s to 120s to 160s. And in hindsight, I also saw that estradiol levels lowering.
Right.
And so for someone like me who says, okay, we're battling this LDL, when someone does start taking hormone replacement therapy and they are starting to kind of right that ship, maybe with hormones, and we can talk about who that can be a fit for and what types, how possible is it to start to kind of remedy some of these things that are these head to toe symptoms?
Yeah. So it's certainly possible, because it affects a lot of different things too. So when you start estrogen, and we'll talk about what else we should do with that, but presumably you're also sleeping better. So then that changes your energy level during the day, and that changes your metabolism. So that all is encompassing, right? And so, we're treating the joint pain. So maybe you can lift heavier in the gym, right? So those things do start changing. And, hot flashes aren't trivial. Women historically have been like, oh, I'll just gut it out. I'll just get through it. Not a big deal. But they are kind of a vital sign for cardiovascular risk to come. And so it's good to pay attention and good to know that and get them under control.
So it's not just even a discomfort.
No.
It's a warning sign there too.
Yeah.
So again, when we say head to toe, it's our brain, our skin, our muscle mass, our cardiovascular system. So I guess as we start head to toe, starting with the brain, what are some of the things that are happening physiologically here?
Right. So our brain is being fueled differently. So that's where the estrogen comes in and where the forgetfulness and the memory changes come in. It doesn't necessarily mean, again, that dementia is in your future, but a lot of women do worry about that. And so, it's good to pay attention to that. And then in terms of skin, there are certainly changes that happen there. Cardiovascular, we've already talked about it. And then
what changes happen in skin? I think that's one where I had one of my close friends. She said, I don't know if this is hormonal or what, but I look in the mirror and my skin just looks and feels different. She feels like her skin is drier. Her face has kind of a crepiness to it. Yep. And she's like, is this perimenopause or am I right on the cusp?
Yeah. Well, you start losing collagen and elastin. Skin texture changes. It's not as thick. It's drier. It's harder to get moisture. Maybe more sun sensitive. We should all be wearing sunscreen. But those are changes that definitely happen that women notice. And women on hormone replacement therapy often say they did notice improvement in their skin.
Right.
Some women also start breaking out. They're like, it's like the second teenage years, right? Like they're like, I feel like I did when I was a teenager,
right,
with my skin. So
on top of everything else,
right,
they're feeling pimply. And then we talked a little bit about sleep, but the insomnia, waking during the night, as you said too, the night sweats, the symptoms that can happen with our mouth and our throat and our voice. Yeah, this is something that I think a lot of people may not connect as well.
Yeah, so just like your vaginal tissue changes and your skin changes, your mouth is, the same kind of mucosa. Sometimes they do notice voice changes.
And dry mouth, like our throat feeling dry, but that's with the effects of that estrogen has on the tissues in our mouth or in our salivary glands. Yes. Which is, I think, again, we just don't realize how interconnected, like that you wouldn't think about something like that being related to estrogen levels. Right.
And some women, itchy ears. That's another one that's just kind of random that I really wasn't aware of. But I started seeing more and more women. I was like, maybe.
Really?
So, yeah. Sometimes that's and you got to rule out other things too. But it's something like, maybe that's something. Yeah. And then the bone health, of course, that's big. Keep your muscle strong, keep working out because it shows up later. And also there are risk factors that, different women have, your weight, your family history, certain things like that. But it just starts declining every year. And a lot of it is also related to muscle. Right. And estrogen affects the muscle. So that's where that comes in.
So joint health, how does estrogen affect that? Yeah. What's actually happening with that connective tissue?
Yeah. So I have to credit Dr. Vonda Wright. She's an orthopedic surgeon, and she's really coined musculoskeletal syndrome of menopause. She was noticing more and more patients in her practice with frozen shoulder. I had this experience. I was having a lot of shoulder pain. I got injections. I did my PT. Somebody wanted to operate. I was like, let me just started my estrogen. And I'm not saying it's a miracle. You still have to get things checked. But it helped me. Yeah. And I think a lot of women come in with joint pain, not even realizing the connection.
Yes. No, I think of somebody who I'm very close with who has constant frozen shoulder. Yeah. You're right. And I'm going to ask her, have you had this all checked? So when someone says, okay.
Enough.
What do I do? Yeah. So what are some of the things, like, there's been such a fear around hormones and hormone replacement, and there's a lot of unknowns. And so for someone who's just starting to have the considerations of, is this something that I'm ready for? And then I was actually just talking with someone last night, a woman who's in her 80s, and she was kind of saying, because when she went through menopause 25 years ago, it wasn't a thing. Yeah. It was just, like you said, kind of muscle it out.
Yeah, she missed the window. Yeah.
So for someone who maybe has fears of this or just uncertainty, like, kind of where's your starting point for guidance and hormone replacement?
Yeah, so I first kind of talk about the WHI, because that is the thing that changed everything, the Women's Health Initiative, and just talk about how that study we now know is poorly done, and it's been debunked. They looked at women who'd been in menopause already for 10 years. They were 60 plus. They already had high blood pressure. They were obese. They gave them one product, a synthetic estrogen and progesterone, and extrapolated that to all women. And that's not necessarily the person sitting in front of me, the patient that I'm going to be treating. And then the black box warning has been lifted finally for hormones. So we really don't think that hormones cause breast cancer. They don't cause stroke. They don't cause heart attacks. We have to take into account, the patient in front of us and what her risk factors are. But there's so much in terms of that can be done now with, less risky formulations. We have transdermal. Of course, if you're on an estrogen, you've got to be on progesterone if you have a uterus. But we just have a lot of different things in the arsenal now.
Do people still have a lot of fears around hormone replacement?
Yeah, so I've got two camps. I've got women coming in locked and loaded, and they have listened to the podcast, they've printed it out and highlighted, they've tabbed the book, and they're coming in telling me what they're going to get. And I've got others that are great candidates, and they're terrified. So there are both, especially if there's, certain family history, breast cancer, if they have high risk for breast cancer. And we have to kind of talk through all their risk factors because it doesn't eliminate everybody. But, we also have other treatments besides hormones to treat hot flashes and night sweats and help with sleep. So we try to talk about the different options. But, I feel like my job is to educate, listen to her story, educate, and then we make a decision together about what she's comfortable with.
And are there side effects for them to be aware of or side effects that are concerning to you?
Yeah, so we talk about the possible side effects can be headache. Headache is the big one. That's usually transient. It goes away. And then somnolence. And some people are like, well, I can use some sleep. So they take it at nighttime. Okay. So the side effect profile is minimal.
Right. And for someone who's really struggling with that and really suffering with that, it can be worth it.
It's a good option.
And they're not making that choice or having the commitment to hormone replacement.
Right.
Any others that are either medications or supplements before we go down and go deeper into the hormone conversation?
Yeah. So those are, indicated medications, and there are off-label ones, which like gabapentin, certain SSRIs, things like that do help with some symptoms, but some of those do have side effects.
Right.
And I think historically women have kind of felt like they went in and got an anxiety prescription, medication prescription, and that wasn't what they were looking for.
Yes,
so, I tread lightly on that, but those are, off-label uses for those medications.
And what about nutritional supplements? There's a lot out there.
Yeah.
And not a lot that I've seen that is shown to be effective.
Right.
But a lot of spaces where women are spending their money in a supplement space. So what are some things that you're seeing people spend their money on something that you go, I just wish this wasn't even a thing?
There are a lot. I guess it'd be easier to talk about ones that maybe are useful. I mean, like vitamin D, I think that's important. Now, I think creatine is important.
Yes.
And I do talk to my patients about creatine because I think there's good data around that. I think, Abby Smith-Ryan has talked about that at UNC. Stacey Sims has talked about it, and I think they've got good data around it.
Around that for muscle mass?
For muscle mass, for recovery, and then for brain fog. So I think that's still emerging.
And when we look at creatine, I'm a huge advocate for it. We've talked about it on the podcast a good bit. So 5 grams a day, up to 10 grams a day. So 5 to 10 grams a day with muscle mass, with recovery from our strength and the ability to basically develop and put on new muscle. Right. To recover from a workout so you're feeling fresher the next day. And then, like you said, that brain fog, the cognitive benefit.
Yeah. And I think that's been really interesting.
I don't think there's anyone who can't benefit from it, and especially someone over 50. Any other supplements that have a lot of a reputation for helping with hot flashes or night sweats that people are trying to kind of hang their hat on, and you're like, don't waste your time.
Black cohosh.
That's what I was thinking.
And it interferes with a lot of other medications. You have to be very careful. And I think people confuse supplements with natural, and so that must be safe, but not always. They're not regulated. A lot of times you don't know what's in them, and they do interact with a lot of medications.
Kind of walk through that. So if someone is starting let's talk about the hormone therapy basics for someone who is saying, okay, I'm ready to consider this. What are the different types of therapies for someone to consider, the different delivery methods, and sort of what would be the reason for someone to be on the different types of therapies?
Sure. So symptoms, hot flashes, night sweats, brain fog, joint pain, all the stuff we've been talking about.
And the estrogen.
Estrogen. I prefer transdermal in the form
patch
or a gel or a mist or a ring. There are 4 different options that are all transdermal. Okay. There's a fem ring, which is different than the S ring. So the fem ring is the systemic. So there are different options, which is great. Some are twice a week.
Which do you like the best?
I love the patch. But I think the gel, some people don't like twice a week. Some people need something daily. So it's nice to have the Diva Gel and the Eva Mist, which are daily. And then if you're on estrogen and you have a uterus, you've got to be on progesterone because you can get uterine cancer. So if you're not taking progesterone. So progesterone is super important. I prefer micronized prometrium, which is a progesterone. And it has a touch of a sedative effect. So most women do feel like it's calming. It helps them with sleep.
And then testosterone. So estrogen would be transdermal ideally. Progesterone, if you have a uterus, is a must. When would you say for someone to consider testosterone therapy, and what are the considerations for women there?
Yeah. So this is a whole podcast, but it's a great topic. It's a great topic. Testosterone is indicated for low libido in a menopausal woman. That's its indication. There is a lot of stuff out there now about testosterone, though. And does it help with energy? Does it help with vitality? Sure, it does. Do women feel good on it? Do they feel sometimes more confident, feel like they get more things done, more focused? They do. But we want to run it at a level that's appropriate for women. Okay. So what I often see is sometimes women come in and they feel great, but they're losing their hair or they've got hair on their face and their levels are high. And what we don't know is high levels of testosterone long-term, how that's going to impact us from a long-term healthcare standpoint. So I follow my patients really closely with levels. It is considered a controlled substance, whatever, don't get me started, but it's not FDA approved for women. And so in this country, so that makes it challenging for those of us who prescribe it. And it's a comfort level that not everybody has, right? Because it's kind of been the wild, wild west for a long time. And now Menopause Society and ISHWSH, the International Society for the Study of Women's Sexual Health, have come out with guidelines. And that's made it a lot more helpful for those of us in this space. And there is a FDA-approved product in Australia that is a transdermal cream. Okay. And so that's kind of what we're using here. We're using male FDA-approved products, converting the dosing for women for the most part.
And so it could be a cream,
a gel, yeah.
Or injections.
Yeah, I mean, those are considered not mainstream. Yeah. There are a lot of people that are anti-injection and anti-pellet.
The pellets I've read can be a problem because once they're in,
you can't do anything about it. Yeah.
Whereas the injection could even be a lower dose, maybe more frequently, but the pellets are like,
yeah, they can stay in more longer term. So, I mean, all of this is out there. Yeah. And I think we need more studies, honestly. But I think, there are good studies out there showing, testosterone use and how women have decreased heart disease when they're on it. Their mental health has improved. There's a British gynecologist who's got a really great study, and it shows how much their mental health has improved on testosterone. So it's important to consider.
So it could be something to talk with your provider about, but keeping your levels. And what levels would someone be looking at? Would it be like free testosterone, or what are we looking at for that?
Yeah. So the societies now, like Menopause Society, is really recommending more just checking total testosterone. We used to check a bunch of other things, but total, and honestly, around 70, around 70, because we don't want the level of a 28-year-old.
Right.
Yeah, you might feel like you could rule the world, but it's gonna catch up eventually and have some negative.
So I think that's one thing for people to just kind of tuck away, talk with your provider. Is this something that's for you? And there are drawbacks, like you said, facial hair, the voice deepening.
That's permanent.
And
that's permanent.
Right.
Because it thickens your vocal cords. So that's a permanent change. So people need to know that.
Yeah.
Yeah, that's important.
And they call it a voice drop, I think.
Yeah.
So that is a very scary thing. So it's not something to just say, oh man, the more I take, the better I'm going to feel.
No.
You could have some irreversible changes.
Yeah.
The facial hair, okay, may be reversible, but something like that, that's a big deal.
Yeah, but the low libido is important for women to be able to address that, because that really affects them in a major way.
And I asked about the level to look at and what that would be for testosterone, but I didn't ask about it for the different types of estrogen, because that's going to vary, I would think, a lot based on someone's cycle and where they are. So I didn't even, it doesn't seem like that's something that's valuable for us to go through a laundry list of numbers, or are there certain markers that you would say when it comes to types of estrogens to look for?
I mean, we don't usually do a lot of testing for estrogen because it can fluctuate even in menopause, just because of the nature of the transdermal. certainly if you're on oral, it's going to be affected by, how you're eating, or, how it gets broken down by the gut. Certainly if a woman has symptoms still, then I might check her estrogen level, but it's kind of a shot in time. And certainly in perimenopause, you can't really follow it because it's all over the place. But it's really based on symptoms and how they're doing on that.
So going back to that person who is saying, okay, I think I'm open to this. I'm thinking about my friend who's saying something's just not right. Sure. Something's shifting. And she's almost exactly my age. And it was about 6 months ago. And she said, for the past 6 months, and I'm thinking, we just turned 50, she's like, there's just something off. So as those of us are starting to kind of look ahead to this, or women, well, I guess 2 questions. The bioidenticals, that's a word that's tossed around a lot, of bioidentical hormones. Is that what most providers are prescribing now?
Yeah, so people confuse bioidentical and compounding. So you can really get most of what you need just from a bioidentical patch, which I send to CVS, Walgreens, Ochsner Pharmacy, whatever. Prometrium is bioidentical. Compounding I only use, for instance, if I have a patient who has a peanut allergy, because that is what prometrium is made from. So I use compounding if I've got somebody who has a real allergy. But really you can get these products that I'm talking about are bioidentical.
And what is the difference between bioidentical and what someone would perceive as being a synthetic hormone?
So bioidentical is estradiol, for instance, whereas other things are made from horse urine or they're synthetic estrogens.
And that's what things used to be years ago. Was
Premarin, Prempro.
And did we not have the option for estradiol years ago?
Not when that first study was done. But it's been around for a while. But then, when everything blew up, blew up and nobody was prescribing it. It was like the most prescribed medication. Yeah. And then
which is crazy.
Yeah.
And when you think about what so many women went through with symptoms and did just have to white knuckle it.
Yeah.
Okay. So the bioidenticals are many, I would say traditional pharmacies, traditional medications are bioidentical hormones.
Yes.
If you had a limitation of a reason you weren't able to take one of those, then compounding is an option.
With the right compounding pharmacy and the right provider. But that's not often, it's just because not all compounding is done the same. And it's got to be done safely.
Okay.
Yeah.
And what about a woman who's not in that perimenopause or new menopause space, but someone who's in, well into their 60s, 70s, if they have been in that camp that maybe kind of missed that boat that first time and they didn't take hormone replacement therapy, and maybe they're not now, is that something for them is there a reason for them to add it in now if they have not been yet?
Yeah, so I think it depends on the woman. Just a public service announcement, any woman of any age with any medical condition is eligible for vaginal estrogen. And I can't say it enough. Every woman should be on vaginal estrogen, because if all menopausal women were on vaginal estrogen or vaginal hormones, we would decrease the incidence of UTIs in this country by 50%. 50. It's huge. UTIs. Because as we age, we present differently with UTIs. Wow. And that's when you get the older lady who comes in with urosepsis.
Right. And especially as we age, if you get a UTI,
mental status, all that changes. So that is critically important, and I can't say it enough.
Say that number again, how much it would shift?
50%, 50.
Wow.
And that's Rachel Rubin, urologist, that's her data. So I think it's good to note that. So the problem with these women coming in now is that they feel cheated. They feel like they, missed the boat. And some of them are eligible, but the issue is it depends on what we're trying to treat. Like if they're symptomatic and they have low risk, then sure. But some women come in because they already have cardiovascular disease. They may have already had a heart attack. And so they're hearing that estrogen is going to help their heart. That's not true. Mm-hmm. So there does come a time when some of these hormones could be not the best. So risk doesn't outweigh benefit. And so that's when you have to sit down with your provider and really look at your risk factors and what we're trying to treat, and have a conversation about safety and what's best for you.
Can you walk us through what some of those questions are? So if someone says, okay, I don't have, I don't have a Dr. Lapeyre in my provider network.
Right.
What are the things that you would say to a person who's maybe perimenopausal, menopausal, if there's different questions of how you would frame it? Yeah. This is where I'd say get your pencils out, but what is it? Start typing to yourself your notes, but where do they start to ask those very specific questions to have that guidance?
So for the older women,
Let's
Or
do
just
all.
anybody?
Yeah, let's start with older women and work our way back.
So, I mean, I think what's important is to this is the time to address your overall health. Like, now is the time. So we all have to work and, with all the risk factors. But I think just this is the time in life to really start focusing on you, because women put everyone else ahead of themselves often. And that's when we start getting medical conditions. And if menopause is the time where you start paying attention, great. But it's not just the hormones, it's all of it.
So it could be really easy to think, oh, I have this fill in the blank issue, my hormones are off. We can't say it enough. We've got to check whole body and having those providers who are working together in that space. And so someone in their perimenopause, early time of menopause, what are they asking for? What is the first steps for them to bring this up and to the first thing to say, give this a try, or here's what you would say would be your recommended. Again, everyone's going to be different, but big picture for most people.
So I think it's good to seek out somebody who's really interested in this, because a lot of times women will come in and someone will draw their labs and they'll be like, you're fine. And they'll go into multiple providers and everything's fine. So you really need somebody who's in tune with some of the subtle changes. Like, I had a woman come in the other day and she had shoulder pain. She was perimenopausal and she had been through all the doctors, had everything checked. We started some hormones and she's better. Now, that's not the case for everybody, but she had already done the other steps and kind of just been dismissed, like, everything's fine, we don't know what's wrong with you. So I think you have to find somebody that's well-versed in the symptoms and the nuances and is going to listen to your story, because so many of us in medicine have 15 minutes. Like, you don't have time. So that's why in our clinic, we've set it up to have consults. We can really sit down. We have a questionnaire, so we get your story in advance. And so look for maybe somebody who's menopause certified. Right. It doesn't have to be, but those are people that have probably taken the extra time and they want to see these patients.
Right.
Because, when I was in residency, nobody wanted to take care of these women, because it was like, yikes, there goes your clinic day. Good luck to you. But I enjoy these patients. And just making a difference in someone's life, like women going through this, like, if you look at the economic burden in this country from days lost from work because women don't feel good and they're not themselves and their brain isn't where it needs to be, it's in the billions. Wow. And at the same time that women are going through this, they're raising children, or they're still maybe trying to have babies.
Or taking care of parents.
Right. And so it is really a lot going on for them.
Yeah. So finding a provider who you can connect with. Say again the certifications that would be certifications. I know we said them earlier, but for someone to look for.
So Menopause Society certification. So and that's not just gynecologists. Those are internal medicine docs, endocrinologists. A lot of other people can get that. But I think they have a website. The Menopause Society has a patient-facing web page, which is excellent. And you can go and do a search, and you can search for providers who are members of the Menopause Society, and you can also search for providers who are menopause certified. That just means we've taken a test, we've taken the extra time. But somebody who's also involved in the Menopause Society means maybe they're going to the meetings, maybe they're the most up to date, because this is a moving target. It is changing and it's shifting, which is great, because finally it's a focus and more people are looking at it.
And we don't want to oversimplify it by saying, get these labs done. This is because it's not that simple. No. And knowing that your estrogen levels especially can change, not even just daily, but throughout the day. And so having those labs done can be also, it can give us maybe some information that can feel a little misleading because it's just a snapshot for right now. So having that provider who's looking at the bigger, longer picture with you.
Absolutely.
And helping guide you through those best. And then also looking, like you said, at other risk factors, looking at, someone's risk for breast cancer and other conditions to really weigh all of these.
Yeah.
Any other last things that we want to say in here that's, I guess, maybe some of the positives or the benefits that, people are coming back to you with once they've kind of gotten this, that balance for themselves.
Well, I think this can be a great time in your life. It really can be. We're the wise women in the room. I think there's this factor of kind of like, I don't really care anymore what you think of, kind of, you know what I mean? Yeah. Like the woman in the gym, like, you know, whatever. Like you see it all on Instagram. I don't know why that gets fed to me, but I just also think it's a time that you can be empowered. Like if you feel good, like if you can really get the right, program for yourself, I think it's not doomsday, because we've talked about all this, the bad stuff. And we also, I feel like I'm always constantly talking to women about nutrition and exercise and sleep. And it's like, these are not mandates. These have to be things that kind of work into your life. And it doesn't all happen at once. Yeah. And we all have to give ourselves grace, because we're doing a lot of other things. But it's never too late to start. That's what I like patients to know. And I also tell my patients, think about where you want to be in your 80s or 90s. Like, what do you want to be able to do? Because what you're doing now matters for where you want to be then.
Right.
And think about it.
And I think so many of us have in our head these models of people that we see that are aging really, really well, and others that aren't, and like, switch path. Do you get, I mean, I would imagine it's really gratifying when you hear how much better people are feeling.
Yeah. It's, I mean, women will be a game changer. That's what I hear a lot. Game changer. Why didn't I do this sooner? This is, revitalized my relationship with my partner, with my family. I'm more focused at work. I feel like I'm firing on all cylinders. It's great. It's great to hear. And
I bet people get emotional.
They can. They can. I've even had husbands write me letters and partners write me letters and, emails, which is just like, oh, okay.
Yeah, that's
great.
Tremendous.
Yeah.
That's tremendous. Well, thank you so much. So somebody wants to know more and they want to contact you. You're licensed in 7 states.
Yeah.
So you can see patients virtually.
Absolutely.
And then we'll also link to, I think, the Menopause Society, the website there. So people can find a provider in their area who does have the certification. And then also the, with Ochsner, the Menopause and Women's Wellness Center.
At Ochsner Baptist.
So we'll link to that as well. So we'll have all of those resources, and I really appreciate
Thank you.
your insight on this. It's an overwhelming type of a conversation, but I feel like you help to kind of simplify and kind of narrow that focus a bit. So I really appreciate that too.
And good hope. Thank you for your time.
A tremendous thank you to Dr. Lapeyre for carving out the time, joining us, sharing her time, sharing her expertise. There's so much to learn here. There's also so much that's evolving. There's so much that science is shedding light on all the time. So this is something that we can keep coming back to over and over, and there's always going to be new information for us. I'll include the links that we talked about in the show notes of this episode, and always let me know what you think as you're running across things, or you're like, hey, these were some symptoms I had no idea that this could be hormonally related, or if there's any ways that this has benefited you, or things we didn't talk about that you think we should have. Let me know. I always want to hear about it. I'm registered dietitian Molly Kimball, and you've been listening to Fueled Wellness and Nutrition, the podcast. If you'd like more Fueled Wellness and Nutrition, please head over to mollykimball.com, and you can follow me, Molly Kimball RD, on Instagram, Facebook, and Twitter. If you haven't yet, please go to Apple Podcasts and subscribe, rate, and review this podcast. Join us next time for another dose of Fueled Wellness and Nutrition. Thanks for listening, and stay focused on living your strongest, healthiest life.